revealing she's diabetic to a shocking report that yoga can cause a stroke. There are plenty of hot topics making headlines, so we're getting answers right now when we ask the doctors. Please welcome Dr. Steven Lamm and Dr. Jorge Rodriguez. Welcome back. First question is for you, Dr. Rodriguez. This morning, Paula Deen confirmed the rumors that she has type 2 diabetes. Many are wondering, of course, did her way of cooking cause this? Is it genetic or a combination of the two that resulted in this? Yeah, well,
it's a combination of the two, definitely, but it's the way that she cooks. I mean, I've noticed, I saw her this morning on another show, and she looks like she's lost weight. It isn't just exactly what she cooked, but it's how much of it. I mean, Paula always looked a little bit overweight. Yeah. So genetics, being overweight and not having enough exercise, that's what leads to type 2 diabetes.
What if you don't have that in your genes? Can you eat whatever you want?
No, not at all. You still can, overweight and not doing exercise makes your body not use insulin as much. That's what type 2 is.
She has type 2.
Yeah.
And she struggles with what to eat. Now, is there one food that is absolutely forbidden?
No, there isn't one food that is absolutely forbidden. It's a matter of quantity. It's a matter of caloric intake.
But the portion control is hard.
I think that, liquid sugar is probably a no-no for most people. Like sodas. Right. The liquid stuff really, because you can ingest so much of it, and your sugar levels go so high. That's called high glycemic index foods. Probably not a good idea.
She's been doing well without that. She's on her 80,000th glass of water today. I think she texted me. Yeah. Dr. Lamm, millions of smokers use the nicotine patch and nicotine gum to quit smoking. Recent study says they may not be as helpful as we think. And you say?
People use nicotine replacement products as a bridge from going from smoking to not smoking. The problem is that this bridge may actually, unfortunately, with the nicotine products, may just return you to the starting line. And that is, it may not, in the long run, realize the potential that it has. In the clinical trials, these patches and gums actually worked. But in real-life situations, when you really watch people, observe them over a couple of years, you find out that many of them, unfortunately, fail and go back to smoking cigarettes.
What about those electronic cigarettes that people are buying on the internet?
Actually, we wrote an article about it in the Daily, a new iPad, an iPad site that I write about, and it's really liquid nicotine. Is the choice of smoking cigarettes or taking e-cigarettes? Absolutely. But if the choice is e-cigarettes or probiotics and vitamin D, I'll go with the probiotics and vitamin D.
You're always replacing one nicotine for another.
Oh, it's also nicotine. I thought it was just air.
There's no second-hand or third-hand smoke problems. That is, if somebody's smoking an e-cigarette, you're not going to be in danger.
And is marijuana as bad as regular nicotine in a cigarette?
Well, marijuana has a lot of other toxic substances, and there may be a lot of, look, I think it's not a great idea to smoke marijuana.
But it has no nicotine.
Yeah.
Okay. And it's also not regulated, so you don't know what's in there. I have to read a statement from Nicotine Group. I just want to say that GlaxoSmithKline Consumer Healthcare, which makes Nicorette, Nicoderm, and other smoking cessation products, they responded to these findings, saying they are premature and that hundreds of clinical trials involving more than 35,000 participants in extensive consumer use for more than 20 years have proven both the efficacy and safety of NRT when used as directed. Moving on. Dr. Lamm, I want to ask you about Alzheimer's, because there was a connection there that the nicotine patch could slow it down?
Well, this is interesting. You look at nicotine patches for smoke cessation, but people realize that nicotine is a brain stimulant. A lot of writers need to smoke in order to continue writing, and they found that people with mild cognitive impairment, when given a nicotine replacement product, improve their cognitive function. That's not the case for people who do not have any kind of cognitive issue, and it's probably not helpful in advanced disease. Now, would I give nicotine to a non-nicotine user to improve I would do so if I were doing a clinical trial.
But you wouldn't just give it to somebody.
Absolutely
you wouldn't
not.
No, of course not. Now stimulants are being overused to think better. That's why kids are abusing Adderall in college.
Exactly.
Yeah.
Next question is for you, Dr. Rodriguez. Comes from Joy, actually. She's going for a colonoscopy, which is great, in February. But wonderful. She is annoyed because you have to drink the PrEP fluid.
What would you say?
She wants to know if you can watch. As long as you don't sing Long and Winding Road.
Now, Steve went for his colonoscopy. He was given the pills to PrEP.
Steve gets pills to PrEP. 32 pills or something. My doctor says you won't.
I'm going to be the one watching. That's what we're going to watch
my
with.
doctor says I can't take the pills, that they can have kidney problems.
No, you know what? It's a matter of private personal choice by the physician. I prefer that my patients take the 4 liters because it gives a better prep. You want all the stool out of your colon. It isn't because it's yucky. We just don't want to miss anything in the colon. So the truth is, if I had a patient like you that doesn't want to take it,
I hate it.
and I feel, you know what, they're not going to do it right, then you should take the pills. I mean, you should be honest with your doctor and see if they can compromise.
He won't do it. He says that it hurts your kidneys.
It isn't so bad, Joy. I mean, I had mine done, and I did the 4 liters. Just tough it out. It isn't that bad.
Come on, Joy. You're tough. You can do it. We believe in you. That's right. What about that swimming capsule? Isn't there a capsule you can take and actually films and it's not as invasive? Is that being used?
The Japanese have this prototype. It's this little, looks like a goldfish. You know,
everything is small with the Japanese. Put a transistor up there.
We already have a camera that you can swallow. I mean, a little pill that you swallow that looks at your small intestine. It's now just a matter of time before it actually becomes very effective for your colon. There's also what is called a virtual colonoscopy. I don't think it's as good as the regular colonoscopy, but it is an alternative.
Yeah, it is, but it isn't as good because if you find something, you still have to do a colonoscopy to go in there and either remove the polyp or take a biopsy.
And the prep is the same. It feels like you have cholera. I mean, you take a prep.
I'm going to also get an endoscopy to check my reflux at the same time. They're coming at me at both ends.
Enjoy the nap and get it done. I think it's going to be the best nap you've ever had.
You're going to be knocked out, so you might as well get it over with.
Exactly. Hey, 15 million people have used yoga to relieve stress. Now we're hearing that it could be bad for you?
You know what? Yoga... First of all, it's not a competitive sport, so you don't have to do what the 20-year-old next to you is doing. It's supposed to be gradual. So you don't give somebody a pair of sneakers and expect them to do a marathon the first day. Can it be harmful? Yes, if you don't stretch, if you don't warm up. There's some reports that very few people have had strokes.
In the hot yoga? Or
well, the hot yoga, I think, is probably the biggest issue. 103, 104 degrees.
Why do people do that?
Dehydrated. You know, because it's an extreme and it feels good.
For the most part, yoga is a really good thing to do. It reduces stress, lowers blood pressure, does a lot of great things. But don't be an idiot about it, you know, and do things in a reasonable way.
See, it's so slow, yoga, that I always feel like eating when I'm doing it.
People get addicted to it. It actually changes brain chemistry. It actually causes relaxation and calming.
Yeah. Maybe I'll try it.
You just have to be careful.
One thing that I want to get to before we go is that, you know, when anyone thinks they're having a heart attack or stroke, they'll take 2 aspirin, right? That's just been common knowledge. Is that something that we should still do?
There's a recent study that suggested that, you know, maybe not everybody benefits from aspirin, and actually some people may get harmed. And we always knew that aspirin can cause bleeding. The bottom line is, if you have underlying heart disease, keep taking your baby aspirin.
Right.
If you have no heart disease whatsoever, maybe you may not need it.
And it works if you've already had a heart attack.
Absolutely.
Then
you will have it.
it.
And older people may actually benefit the most, so...
We want to thank Dr. Lamm and Dr. Rodriguez. As always, please consult your personal physician for advice suitable to your personal medical circumstances. We will be right back.